you actually want me to give people a pill or a referral, because if I refer to a specialist office, or if they're sick enough for me to refer to a hospital, you get more money. So my patients are getting sicker and sicker. I'm getting ruder and ruder because I'm being coached to cut people off, and none of this is about patients. You lock them into the golden handcuffs with the non-competes, and you get their lifestyle to be so expensive that they can't afford to do anything else. Bust the myth, like do a magic wand to take the myth out of everyone's brains that health insurance equals health care.
What happens when a doctor decides she's done playing by broken systems rules? Dr. Jade didn't just leave traditional medicine. She's building a future where healthcare is personal, accessible, and designed around the patient, not the profit. This is a story for every woman who's ready to rewrite the rules of her industry. Dr. Jade is the founder and CEO of Nspire Primary Care in Las Vegas. It's a modern membership-based medical practice putting the care back into healthcare. With extended appointments, direct access to your doctor, and a focus on long-term relationships. Who doesn't want that? She's showing families what's possible when we put people before red tape. As a physician, entrepreneur, wife, mother, community member, Dr. Jade is not only disrupting an industry, she's redefining what it means to lead with purpose. You've got to be a part of this real money conversation with Dr. Jade, and it starts right now. Dr. Jade.
Hi.
Hi. You were the first person when I thought about this season, you were the person I wanted to kick this season off with, because I am on fire about the healthcare industry right now. And I feel like we've talked about this in private conversation, that the thing that I think is broken the most is the insurance industry. And right alongside of that is the medical industry and how patients are being served. And I know that you have some feelings and thoughts about that.
Absolutely. I'm excited for this conversation.
Yeah. So thank you for being here. Thank you for spending your lunch hour with me, because I know you're in your office and I'm sure you're going to turn around and see patients right after this. So thank you for spending this time together. Side note, if you're listening to this episode before October 9th, 2025, Dr. Jade is speaking live at TTL right here in Las Vegas. She is going to be on stage with us. And so if you want the opportunity to see Dr. Jade live, speak with her live, you've got to grab a ticket because we're almost sold out. Shameless plug. There you go.
Love it. I'm excited about it.
Beyond that, the reason that you're here is that I trust you as a medical professional. We are on the same page about making a difference in the Las Vegas Valley. This podcast isn't just for Las Vegas women, but when I started my company, I said the very first women that I want to make a difference with are the women in Las Vegas. So we're speaking to you, Vegas and Henderson, and then any other woman on the planet who is also joining us today.
Yes.
Okay, so let's start with the origin of this. And you have so much, I've heard you share so much goodness about this. What was the moment or realization that pushed you to challenge the status quo in healthcare?
I would say it was a mix of learning about what the actual business of medicine is. And so as a child, I wanted to be a doctor. I started saying I wanted to be a doctor at 4. And then, of course, as a medical student, pre-medical student, high school, I'm like shadowing doctors. So again, you're just getting that snapshot of like a little bit of what clinic life is like, right? And so all of that would just look so nice. And then, of course, med school, everybody expects that to be hard. Like you're working all the time, you're studying all the time. It's like, okay. But then residency, that's when you are officially in your specialty and you're just seeing patients and being overseen by a attending physician. But this is now you're in your career, right? Not fully in your career because you have to finish residency, but you're in it. And that was when I first realized, oh, this is what medicine is. And not only this is what medicine is, but this is what the business of medicine is. Mm-hmm. So the turning point was really my first year and a half of residency, literally the joy of medicine being sucked out of me when I've gone through 15 years of training and been saying I've dreamed of doing this since 4 years old. And now I'm here at the end of the finish line where it's supposed to be like the rainbows in the pot of gold. And it was misery. And some of the things.
Yeah, you're going to go into that. What was the misery?
Things was the requirements, first of all, finding out that doctors don't work for patients, doctors work for insurance companies if you're employed in an insurance based practice, right? And that may not sound so bad, but everything as far as rules and regulations that doctors are under all fuel the insurance company's revenue. It doesn't fuel making people healthier or spending more time or improving quality of care. So once I realized that, oh, I'm required to be in and out of the room within 5 to 8 minutes, that means I only have time to give people a pill or a referral. You actually want me to give people a pill or a referral because if I refer to a specialist office, or if they're sick enough for me to refer to a hospital, you get more money.
Mm.
And if I only spend 5 minutes with someone, you can double or triple book the calendar. So then you drive more revenue in the clinic schedule. So when I started finding all of this out, and then we started getting coached, because the whole point of being in residency is you're being coached on how to be a physician. So then I'm
Okay.
being coached on, okay, if you're having trouble getting in and out the room within 5 to 8 minutes, at minute 4, we'll have the nurse knock on the door to rescue you.
Oh
Or,
my
okay,
God.
yeah, or if you are having trouble figuring out how to like get the patient to get to the point, cut them off if you need to, and let them know, hey, we can only answer the top 1 to 2 things that are most important with you within the 10 minutes that we have for this visit. Or being coached to like put your hand on the door, that will signal to the patient like, oh, my doctor has to leave. So all of those things just showed me like, oh, my patients are getting sicker and sicker.
Mm-hmm.
I'm getting ruder and ruder because I'm being coached to cut people off, and none of this is about patients. And so all of that, thankfully, in residency is when I learned out about concierge style models and membership models of healthcare and primary care. And I'm thankful to have found out about that at that point so I could open my practice straight from residency and do it completely different.
Were you having those days? So I'll parallel this to my experience in the money industry, growing up in the money industry, kind of in my 30s.
Yeah.
I was walking into rooms full of people who were financial professionals, and I was like, oh my God, this is so not what I thought it was going to be. And it was really centered around selling financial products,
Yep.
how the products work, guys talking about how much money they're going to make, and if it's worth it to make the offer to the client. And I had a visceral response to it. I was sick to my stomach, literally. Like, I can't do this. This is so incongruent with who I am. I want to help people.
Yep.
And this doesn't sound like or feel like I'm helping people. Did you come home at the end of the day rocked? Were you having conversations behind the scenes with other residents where you're like, this is wrong? What was that experience like for you?
Yeah, it wasn't so much feeling like it's wrong
Oh,
because we were all trying, like as the physicians, we were all trying to do the best we could within the model we work in. And I always say that about insurance-based physicians. I feel like most physicians are trying to do the best they can, but they're in a system that doesn't allow them to be great physicians. And I could not be a good physician in that model.
yeah.
But what it did illuminate for me was the misery ahead. Like I already was starting to feel the misery, but people expect for it to be hard because you're a resident, right? And so you have
Yeah.
80+ hour weeks. And so it's like, of course, residency is hard for everyone. But then I looked ahead at the attending physicians, the employed physicians, the head of me that were out of their
Mm-hmm.
training, and they all looked miserable. And I was like, wait, I get to look like the grand prize is looking like you in 10 years. And so I was like, none of you are happy. All of you are trying to figure out either how to leave medicine or counting down the years or, figuring out if you can become a real estate investor. Like no one here is like, I love this. Everyone looked completely drained. And I was just like, I don't want to look like that. And they were all
Mm-mm.
staying after hours, taking work home, getting more responsibilities added to their plate for less money, like all the things we dealt with as in training, but on steroids. And I'm like, oh no, that's
Mm-mm.
not what my life is going to look like.
Good for you.
Yeah.
Good for you. And there's a trade off, I would imagine. So I was having this conversation with my teenage boys, and one of them was saying, well, I want to go to college to get a good job,
Mm-hmm.
or I need to graduate high school to get a good job. And I'm like, listen, the whole goal is not to just get a job.
Yeah.
But it sounds like from conversations I've had with you, and it looks like, and it feels like that a lot of people are just going through the motions to get a good job.
Yeah. Yeah.
And
Absolutely. Well, when you think about medicine, most people that go into medicine, it's usually a calling, right? Like
mm,
this internal calling to medicine to help people. And so most of us don't have this business entrepreneurial mind, able to analyze and take a step back and be like, oh, wait, I can do this better. And this is how I can do it better. So a lot of it is like, oh, I've been dreaming of this dream career and I've been studying decades to get to this point. And so, yeah, I think it's a lot of that is just physicians are often preyed upon because it's like, oh, they've just been in the library for over a decade. They have no idea how we make money, how we make money off labs, how we make money off meds, how we make money when they refer. Like they have no idea. Like just give them a sign-on bonus because they've sacrificed and they've had this delayed gratification for this decade and a half. So all they care about is a sign-on bonus, stable income, finally making six figures, and a peaceful life as a physician. Like, and if they can just sell you on that dream, we call it the golden handcuffs, right? And it's like we lock them into the golden handcuffs with the non-competes, and you get their lifestyle to be so expensive that they can't afford to do anything else. And yeah, I'm that's why I'm glad I found out about it in residency, because I'm like, okay, well, I'm already living off of a resident salary, so everything is going to be up from here.
Good for you.
Yeah.
So that had to have been a reckoning, though, like vision wise. It sounds like I believe that when the student's ready, the teacher appears, but you were probably already looking for ways out when the out appeared. How did that happen for you, or were you not?
So I'm a woman of faith. So for me, I just believe God's timing was just perfect, and He answered my prayers because growing up, I always had an entrepreneurial spirit. Like I was always that person where if I found something I loved, I would figure out how to monetize it. So like I was into art. So I was like, oh, I started a little art business on Etsy, right? I was just always that type of person. So I feel like I'm naturally entrepreneurial. I just didn't know I was, I didn't have that name for it.
Sure.
And so, but I also, when I was shadowing in high school and undergrad, I was always shadowing physicians that were in private practice. And back then, a lot of physicians that did go to private practice, they owned insurance-based private practices. But then once I was in medical school, it was almost like most of those had been bought up by corporate America. So we were kind of taught like private practice is a thing of the past. Insurances have bought all of those businesses up. So you can't do that anymore. You can only become an employed physician now. That's kind of how we were trained. And so it was like God answered my prayers. I just was having a conversation with one of my attending physicians over lunch. And all of my colleagues were signing contracts. I was like the only resident left that hadn't signed a contract yet. And she's like, Jade, what are you going to do? What are you going to do? And I was like, and at the time I was pregnant. So I wasn't in a rush to sign a contract because I was in California. We were going to move back home to Vegas. I was going to have my baby. And I was like, okay, I have some time to like figure this out. And I just started telling her like my dream and my passion. And I was like, I want to take care of people well. I want to have time for patients. I want work-life balance. I want to help people get healthier. And she was like, oh, it sounds like you may be interested in something called direct primary care, which is the concierge style medicine that I do. And I didn't know about that. And I just started going home. I Googled it. I learned all about it. It was the pandemic, so all of the national conferences were online, so I was able to attend them. And I just learned about this whole community of physicians that were opening membership style practices. And it was like I found my tribe, like right at the right time. And it was a blessing. I became friends with them. I went to their practices. They mentored me, and I met a community of them that opened up straight from residency. And that was like, oh, well, if they can do it straight from residency, then I can do it straight from residency. So the timing just all aligned.
That's amazing.
Yeah.
That is amazing. It was meant to be.
Yes.
Yeah. And you jumped on it just like any entrepreneur would. Yep. Like, this is a fit. This is aligned. This is something I teach in my world. So as for my listeners, it is so important that you're aligned.
Yep.
And you're such a great story, an example of when you're not aligned, how to be honest with yourself, because you could have put yourself through hell for years, but you listened.
Yes. Yeah.
And that's so important.
Yeah, absolutely.
So
yeah.
Let's talk about risk then.
Yeah.
Because there's a model basically, hey, if you go this way, you'll make money, although there are golden handcuffs that are attached to it. What is the risk that you put in that you had to take financially and otherwise to start your own business? We'll talk about how it works.
Yeah.
What were those conversations like at home? You're pregnant?
Yes, I'm pregnant. And my husband met me when I was a medical student. So it's like he already was in his career and, he meets me as a medical student. He's like, okay, just finish school. So it's like he's been on this journey with me for over a decade, and we get to the finish line and I'm like, oh, I'm not going to sign this contract. Will you get on board with me opening, us opening a private practice and us starting a business? And it took both of us learning. Like we had the residency was a blessing because it was like, okay, in 3 years you're done. And so we had 2.5 years at that point to really learn about the business of, this style of practice, to, get to know people, ask questions, get to know other husband and wife duos. And I was blessed that my husband is W-2, or at the time he was W-2. He's partially W-2 and now in the business as well. But at the time he was fully W-2. So it was like, okay, you're handling the bills. And I was in a position where that allowed me to just moonlight a few urgent care shifts, one, have the baby and recover I gave myself a short period of time to recover. But then I took on a few urgent care shifts a month and did the practice a few days a month, and then took off the urgent care shifts as the practice grew until I was full time in the practice. So I say all that to say we had a strategy and structure, a business plan. It was well researched. We really studied the industry so that we were at least having, of course, it's risk, but we had the best formula we could to help make it to be a success. And thankfully, the formula worked.
I would believe that Vegas was ready for you.
I would hope so.
Everything.
I would hope so. I don't know if it was that Vegas was ready or if again, I think it's really just God. I just don't, I don't think it was anything in my strength, because I have other colleagues who did open around the same time and it didn't work out for them. And then I have other people who opened around the same time and it exploded. And then I had my own pace. So I don't really know. I just know that I focused on, okay, what can I do? What can we afford as a business? I'm not going to look at anything as a limiting belief, but okay, I have a newborn. Like we opened my practice when my babies were 2 and 8 weeks old. So I had the second baby, and I gave myself 8 weeks to recover. And at week 8, we did a ribbon cutting. So I'm like, okay, I can't be out in the community networking like some of my other colleagues who are opening new businesses. Okay, what can I do? Oh, I can have my cell phone and do social media. All right, so I'm going to double down on all these videos, get the word out that way. So I just had to be strategic. Yeah.
You were strategic. And what's been your biggest surprise so far?
That's a really good question. I haven't been asked that. The surprise is how much I love business. Yeah, because when I opened this practice, I really was trying to take care of patients well and have a balanced life where I could enjoy being a wife and a mom while being a doctor, right? And that was the initial that was the thing. And now that we've grown and scaled, and I've really grown into a for real entrepreneur, right? 3 years later, and I love the marketing and the sales and creating the funnels and doing social media and networking. Like I'm an introvert by nature. So like 3.5 years ago, if you said, well, do you like networking? I would have like started to sweat and like feel like nauseous and be like, I hate networking, but I love it now. It's like the complete opposite that I never, ever thought would be a thing for me. So yeah, like the business development, I've really fell in love with business and growing not only this business, but the mindset of like, oh, wow, I could, run other businesses too. Yeah. So that's a surprise.
Yeah, I love that. You are an entrepreneur at heart.
Yeah.
Yeah, you are. Doctor and entrepreneur.
Yeah.
It's amazing.
Yeah.
You could wave a magic wand and change one thing about the healthcare industry. What would it be and why?
I think I would bust the myth, like do a magic wand to take the myth out of everyone's brains that health insurance equals healthcare. Wow. And our country has done such a great job of programming us all into thinking, oh, let me get insurance and I have good insurance and I've got my card. It does not equal healthcare. And if I could just really expose and like lift the veil from our eyes of like, wow, this is actually what the cost of things are if I go through insurance, when the price actually costs this much more. And being cash pay in a lot of areas in the primary care realm actually is going to save me so much time and money and give me the potential of better health outcomes versus using my insurance for every little claim. So if I could really like have a magic wand to just show people the truth and like unveil that and people to just get it, oh, it would be amazing. But that's why we, teach and talk, and it's a process. Yes.
It is a process. So let's break it down. Let's get some nerdiness going on the money side, because this is totally my jam. Is I've heard you say before that you're in the business of healthcare, not sick care.
Yes.
And you walk the talk. You are living a healthy lifestyle. You and your family live and lead this healthy lifestyle. If you don't follow Dr. Jade yet on Instagram, please follow her. She's so inspirational. But you play pickleball with the family.
We love pickleball. We are a pickleball family. Yes.
I know. It's so great. Okay. So let's break down the costs, the real costs when it comes to insurance versus private care. Specifically, if someone's on the fence, how can they save money by not using their health insurance?
So first, I like to give an analogy to just help with the mind frame of what we're doing. Because a lot of times when people hear concierge medicine, they just think expensive, or they think doctors are doing this because they want to make a lot of money, or they think that's not for me. So let me just paint the picture of an analogy we're all familiar with. So I like to compare it to the car industry, right? So we have our car, we have car insurance versus car maintenance, right? And so imagine with your car, if you went to the car wash and you're like, I need to use my insurance card for that. And then you go to get gas and you're like, wait, let me pull out my insurance card for that. And then you go to get an oil change and you're like, hold up, I need to use my insurance card for that. Like, imagine how slow, frustrating, delayed that would be if we processed our car insurance for every little aspect of maintenance. But instead, with car insurance, we get into a car crash. We know we need to pull out our car insurance, right? Because that's a catastrophic event. Every insurance, we use it in that way, except health insurance. So now we flip to health insurance, to your question. So now people are like, oh, I have a question for my doctor. Well, we need you to come into the office to collect your copay. We need you to wait 3 months to get into the office. We need you to wait 3 hours in the office. And then we'll ask your insurance if they'll pay for these things. You might get a surprise bill on the back end. So that is what we're doing if you need a refill. That is what we're doing if you have a health question, which is why you're going to Google and TikTok and all the things. That is what we're doing for your health maintenance, for mammograms, for lab work. That is why your healthcare is slow and delayed. So what we're doing is removing insurance from the prevention, from the primary care, which is acute care, chronic care, preventive care. That's 90% of healthcare needs that we do not need to process an insurance claim if we just do a simple membership model. Like, get as much of the healthcare as you need for a flat monthly or annual membership. Your healthcare team and your doctor is a text and email away, phone, video, in office. And then if we need to send you to the hospital, or if we need to send you to the 10% of things that fall outside of the primary care office, if you have insurance, you can use your insurance card for that, right? Gotcha. It literally strips away 90% of the delay. And then when you ask about money on the markups, right? So now in our office, all in-office primary care procedures are free, included, right? Because if you need a joint injection, if you need a pap smear, if you need earwax removals, if you need skin tag removals, etc., all of those are things that primary care physicians are well trained in if they have time in the office to do them. We don't need to add a markup to that, right?
What? Yeah. Who knew that?
Yeah.
Who knew that?
So that saves thousands of dollars for patients just off of that alone. But then we don't know about all the hidden markups by using insurance for all the ancillary services, right? So now if you send labs to the lab, right, an annual lab panel through insurance, they will do a 10 time or more markup on every single lab. But what we're able to do in this model is basically, you can think of it like a Costco model or Amazon model. We're able to get the wholesale pricing without the insurance markups. So then we're able to add that as a membership benefit where your CBC is $6, your cholesterol panel is $6, your A1C is $3, because now you don't have the insurance markups on it. Same thing for mammograms, imaging. All of the things we go to the imaging center, we've gone to them and said, I want the wholesale pricing without insurance markup. What is that price? And now we're able to give that to our members. So what is beautiful for our members is if they have insurance, they now can price check and see what's more affordable. So sometimes I'll have members that are used to using their insurance card say, nope, I want to use my insurance card for the mammogram. And I say, okay, just so you know, it's $85 if we do it cash, but we can process it through your insurance. And then they'll get a bill for $280,
Yeah.
right? And then the next year they need their mammogram. They're like, nope, I'll take the one from the cash pay. And so they get to learn how much more expensive it is to use their insurance card. But of course, when they need to go to the hospital, then it's like, yes, use your insurance card. That's the appropriate time to do so.
Catastrophic.
Yes.
And there are actual insurance policies. I learned this from you. There are actual insurance policies that are for catastrophic only.
Yes.
So you don't have to pay for all the other things through the insurance. To your point, you can pay for them privately.
Absolutely. And those
How does that work?
Yeah. And I always tell people I'm not an insurance agent, but of course I have a lot of insurance knowledge,
Sure.
with what I do. But this is meant for healthier people, right? So a lot of people will tell me, oh, I'm healthy. So I either just don't have anything or I have like a traditional, I have good insurance, right? And so I think of it like a restaurant. When you go to a nice restaurant, they're like, oh, this steak pairs nice with this wine, right? And so it's like, what health insurance plan is best for you, or is best customized for your needs, right? And so for a lot of my healthier patients, it's like getting a concierge style practice like Nspire Primary Care, and then pairing that with a high deductible healthcare plan where your monthly rate on that insurance is low, but it covers all the catastrophic needs that fall outside of the concierge practices services. That pairs really nicely. However, those plans are underwritten, like health underwriters go through that. So if you have certain health history, like chemo or cancer, or even sometimes like type 2 diabetes, then you may not qualify for those plans. So
Gotcha.
It still has to be customized. Yeah.
And there are employer plans too. So if you're a W-2 employer, you could still use those plans. You just may not need the PPO plan.
Absolutely.
Example, right?
The exciting thing, I don't know if you heard about this, but this is good for your industry to know too. The really exciting thing, so we work with a lot of employers in Vegas, small and medium businesses. But the cool thing about the big, I'm not into politics, but the cool thing about the big, beautiful bill that just got passed is that they officially put into the new law that direct primary care practices can be used for your HSA. Before it was kind of gray. So this now opened it up for employers so they can officially utilize HSA high deductible plans for their employees, so they can now use direct primary care practices for their offering to their teams. So that's like a huge thing in the direct primary care movement that we're all excited about.
Yeah, that's super exciting. That's great to know. I hadn't heard that yet. I really haven't digested the whole bill and all the different implications of the bill. That's great news.
Yeah.
Great news for everybody. Let's talk about money from the practitioner perspective and then from the patient perspective.
Oh, I love that.
What was the trade-off for you, if any? Are you making more money as a concierge doctor than you would? And give me some numbers to put my hands around and for our listeners.
This is a good question because I'm now a business owner, right? So I'm not, so this is a question a lot of direct primary care physicians that are considering leaving and coming to business, they'll ask like, okay, well, how much do you make and how does that work? And I'd say, well, now you have a whole different mindset because now you're no longer an employee. You've unlocked this whole different pathway to entrepreneur. And so before, like, my goal is no longer for my W-2 to be as high as possible, right? We know as business owners, that is not the goal.
That's not the goal.
That keeps your taxes through the roof. And not that I don't want to pay appropriate taxes, but there are incentives for business owners, right? And we are learning over time to take advantage of more and more of those incentives as our business grows. So on one end, is my W-2, is it higher than it was? Like 250 is like the average for a primary care physician, right? Okay. My goal is not for my W-2 to be 250, right? Correct. However, so much of my lifestyle is now a legitimate business expense that I don't pay for very much, right? So what that looks like is my vehicle. Now I have a very nice custom company vehicle, and that's a business expense. I don't pay for that. The company pays for that. It's not my car. It's the company's car, right? My children, they are on payroll because, like you just said, my whole family is on social media. They are brand ambassadors for our business. And so they are on payroll, and that pays for their private school tuition. And so these are things that would have come out of my personal side that do not come out of my personal side. And it goes on and on and on. My cell phone, I don't just use that cell phone for my personal calls. I don't really even talk on the phone very much, right? Most of what I do on my phone is texting my patients and responding to business. So that is a business expense. And I could just go down the list, but very few things truly fall outside of my business. And
Yeah.
I'm also learning through my accountant and my bookkeeper the things I can't just say are business expenses, because I like to have
Right.
photo shoots and I'm like, hey, hair, nails, makeup, I'm on camera. And they're like, okay, some of this is personal. And so I'm learning the legitimate things.
Yes, it's called a balance.
Yes,
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 you gotta be smart about it.
yes,
I love the way that you put that, is that as a business owner, you're seeing full circle, well-rounded, how your business and your life can work together. It's not either or,
yeah,
and it's not separate. But it's not just that you're going to be making 250 W-2. You're also not working like those doctors are working.
no,
And to your point, selling your soul. I think
no,
you might have said that. I say that. You're doing it the way that it works best for you and your family and for whole health. And I love that. I love
absolutely.
that.
Yeah,
Yeah.
yeah. My clinical calendar looks nothing like it would look if I was traditional.
Exactly. Okay, so now let's flip over to the patient side, where I heard you say you could save money in concierge health.
Yeah.
What is that like for someone who's in concierge health? What do you mean save money? Because that's the perception. You hear the word concierge and you're thinking, okay, Ritz-Carlton.
Yes.
But that doesn't sound like that's the case.
No, not at all. And that's why I try to word it as like concierge style healthcare or membership medicine, because we're all very familiar with having memberships for just about everything. And
Yeah.
so that kind of takes away the stigma of, oh, this is for the elite. It's like, no, this is just a membership model for primary care. And once people are able to frame it that way, like, oh, I have memberships. It's Netflix, but primary care. It's Costco, but primary care. It's a gym membership, but for primary care. So that helps, first of all, to just frame it for us all.
That's right.
And then from there, things that save money. I already kind of told, like x-rays, for example. I had a patient who used their insurance for their x-ray, and I told them up front, x-rays are $25 cash. Okay. And they said, well, I think it might be covered under my insurance. I said, no problem. We sent it with insurance. So the lab processed their insurance plan. They got a $300 bill 3 months later.
Wow.
And then they're like, wait, can we go back? And I'm like, no, you have to pick cash up front. But next time you need an x-ray, we know to go with the $25 cash x-ray. So that's one example, right? Same thing for mammograms. I'll have people that don't know what the price is, because sometimes I'll say, call your insurance company and let's see if they'll tell you what the price would be. A lot of times they won't tell the price and they can't get somebody on the phone, so they just don't even know. But I tell people, like, hey, well, every October, the imaging centers in Vegas do a cash discount because it's Breast Cancer Awareness Month. And they do a cash discount. We can just do your cash mammogram in October, and we'll know the discounted price. So we are able to help navigate a complicated healthcare system for our members, where they're like, I know exactly who to go to. Same thing with specialists, right? With the best cash pricing, who have the best patient experience. And so we're just saving people time, making their healthcare more efficient. Same thing for sleep studies. Like, I had a patient who joined my practice, and she's like, I went to this sleep center and I had to they processed my insurance. I had to spend $300. And then they told me that they had to redo the sleep study because I couldn't sleep in this center. And I'm like, oh, we don't even send our members to sleep centers. We send home sleep studies, and those are $175. And so it's just like, and they're like, I could have did this at home for cheaper. Yeah. And so all of these little things. I had another patient who cut their hand open, was dicing in the kitchen, cut their hand open. They hadn't joined our practice yet. They had been looking at our marketing, but they hadn't joined yet. And so they went to the urgent care to get sewed up, to get a laceration repair. And they got I think they told me their bill was $600, and they have good insurance. $600 for a laceration repair that would have been free, because because in-office procedures are free. So they could have just texted us, scheduled to come in the office, got it sewed up. It would have been included in their membership. So it literally just goes on and on.
Yeah.
Yeah.
It's a lot. It's a lot. We are in the middle of, or beginning of, a huge disruption coming the medical industry way. The point of this conversation is for you listening right now to know that you have other options. Yeah. And the truth is, you're paying for insurance anyway. Even though it might be coming off of your check, go look at your check and actually see what you're paying out of pocket for insurance, because it's not free. Your employer is also paying the price for your insurance. And I've had these conversations on the back end with business owners, and I know that you have too, looking at these total costs of insurance. They're facing very difficult decisions because so many of these business owners are not really able to afford health insurance, but they want to do the right thing.
Yep.
And you have an alternative for small business owners, medium-sized business owners, which is Join Your Practice. What kind of savings are you offering? Does it offer businesses?
Yeah, it's really exciting, our corporate membership in our practice. So when we first opened our practice, of course, we were looking to care for entrepreneurs and busy professionals and their families, right? So retail, we call it, the individual, the one-to-one side. And that grew so much that we attracted so many business owners, and they're like, hey, can you customize something for my assistant? I have a team of 3. Can I just offer this to them? And then that really built out the corporate side of our business. And so the corporate side is where small and medium business owners offer our primary care membership to their teams as the healthcare benefit, plus or minus pairing it with a high deductible or a customized insurance plan or an HSA account. And it's been amazing. Like, business owners have been like, first of all, this is saving money because they know the exact flat rate per month per employee. And our employers, our corporate partners, choose if they're going to cover 100% of the membership, which we do a discounted rate for corporate clients, or if they're going to contribute 50% of the membership and have the employee deduct the other 50% from payroll from the employee, which again can have it be as low as like $75 for the business owner, right? And so it's just like per employee. So it's like so affordable, first of all. The other thing, like, we acquired one of our corporate partners is a local school and daycare, private school and daycare. And her problem was her teachers kept calling off. Like, they would get sick, they would call off, and they have a whole classroom of students and children who need care. And I told her, we pitched our corporate partnership to her, and she's like, I'm willing to try anything at this point, right? And so she just told us, like, this transformed her whole business, because now she knows that she's paying for something where the doctor is a text message away. We're basically like the team doctor for their business. And then her teachers would like use their lunch break to do their Zoom call, right, for their appointments. Or they would text when they had their 15. And then when they got off work, their prescription was already at the pharmacy. And she said it was just a complete night and day difference for her business, for the absenteeism and how much money they were losing just by them scrambling every time a teacher had to call off. So we've been able to do that for businesses in Vegas, and it has just been a joy. Also, to take care of people who wouldn't think they could afford it, or maybe truly couldn't, but their employer is contributing part or all of the membership. So it just also unlocked a population of people who may not have been able to be members of our practice. So we're just solving problems and helping people get healthier, and it's been really rewarding.
Yeah, I can tell. I can tell you're energized by this conversation.
Yes.
I am too. So, real deal. What is a membership? How are there different tiers? What is someone having to think about financially when it comes to, okay, what's the monthly commitment here?
Yeah. So if you're an individual if you're in a different part of the country, you can look up direct primary care practices in your area. In general, direct primary care is usually between $100 to $200 a month. Okay. In Vegas, our primary care membership is $200 a month retail side for individuals, business owners, families. We do a pediatric discount. So if it's an adult and they're adding on their child under 18, we do $50 a month. So we make it pretty inexpensive to just add the kiddos on with adults. So basically $200 a month per adult. And then it is discounted for business owners.
I love that. So you're thinking you're probably spending that much at Lifetime Fitness.
Exactly. Yeah.
To take care of your body, to stay healthy. Why wouldn't you also then make the investment and have the care that you're worthy of? And
Absolutely.
The care that you,
Absolutely.
I love that.
And we love to let people know that HSAs can be utilized for this, whether you're doing it as the employer or if you're just an individual that has an HSA. A lot of our local Las Vegas people will just pay for the annual membership with their HSA funds. And so that's really nice too.
Win-win.
Yeah, absolutely.
Win-win. Did you ever think you'd be working with your husband? Was that the plan all along?
It was not the plan. My husband is a tech guy. Because people ask me, like, what's your husband do? His background is technology. He helps keep the Wi-Fi on for like a lot of the properties on the strip. And so he is a tech heavy type of guy. And a lot of what he does, I do not understand. I'll hear him having his tech meetings and I'm like, oh, that's a different language. So no, we didn't know that our worlds would collide. Now, of course, we have a nonprofit side of the practice and just a nonprofit for our family. And so we always knew on the nonprofit side, our family would work together to build that aspect out. But we didn't know on the for-profit side, on the business side, that it would come in a line. And so, yes, it's been really beautiful for him to, as the business grows, for his role in the business to continue to grow more and more. And now we have a pathway for him being full-time as well. And so it's exciting.
That is exciting.
Yeah.
You're one of many professional women that I know who are the face of the business, where it's their business and the husband is, quote unquote, your husband's not behind the scenes, by the way. Check out her Instagram page. He's all over the place.
I forced him on the camera. He would love to be even more behind the scenes, but he's a good sport.
I'm sure he would. But this is also a trend that we're seeing for women in business.
Yeah.
The women are leading, the men are supporting. And how's that working for you guys at home?
Yeah, it's interesting because I don't really think of it as like I'm leading and he's supporting. I think we're just both rowing in the same direction and like a true partnership. And that's always what I desired, regardless if we had two separate careers, but just a true partnership where we're rowing the boat in the same direction. And we've learned so much. Like I had to learn what my lane is versus his lane. Like I'm super type A. So I had to learn like, Jade, let someone else do their lane. This is your lane. Okay. Your lane's over here. And so, yeah, or like delegating something off and then trusting that that will be done within the time frame, us having executive leadership meetings and coming together in an organized system and way and time. And so really systems, right? Building that out was really important. And also having boundaries, right? Like, okay, this is date night. Okay, this is our time off. This is family time now. You're not Dr. Jade right now, right? And so us figuring that out, and we're continuing to figure that out as we go. But it's just been a joy. I've been really thankful.
Yeah, I love that so much. Yeah. I love the thought. And my husband and I are on the same page of we're doing life together.
Yeah.
And how cool is it that you get to do all aspects of life with your best friend?
Yes, absolutely. Yeah, I'm really thankful.
That's so great. When the next generation of women leaders looks back, what do you hope they'll say about how women like us changed the game?
They went for it and they didn't quit. They were willing to take a risk and take the first step. Because that's the scariest part is taking the first step. And I shared this recently on my social media is that every stage is scary. And so it was like opening was the first scary thing, right? And then hiring my first employee was the next scary thing. And now we're bringing on a second provider. We just expanded to a second space. And so now, that's the new scary thing, right? So every stage, it never stops being scary, right? But still taking the leap of faith.
Keep going. Yeah. Don't give up.
Yeah.
Rhiannon, who, Rhiannon
Absolutely.
in town, she's been on the podcast. There's no plan B.
Exactly. Yeah.
This is it.
That's what people used to ask me, like, well, what happens if you can't be a doctor? No, I'm going to be a doctor.
It's just not possible.
Yeah. Well, what happens if you have to go back to work in urgent care? Well, I'm not doing that. So
that's not.
Yeah.
Yeah. You're a woman with confidence, with grace, with faith, walking the walk, talking the talk. And I hope that you'll be someone in our community for years and years to come that will be leading the charge.
Thank you. Really it's a pleasure to just be in my hometown. Like this was my dream, was to improve healthcare in Las Vegas, where I grew up, I didn't have quality care growing up here. And it's happening. And I'm thankful.
Yeah. You're leading the charge.
Yeah.
It's amazing. Yeah. So we have something fun in the end of the show. It's called Rapid Fire, and it's my favorite game to play on road trips and with people in general. So it's called This or That.
Oh, okay.
You ready?
Yes.
Play or pause?
Play.
Rules or rewrite the rules?
Rewrite the rules.
Big leap or steady small steps?
Big leap.
Early mornings or late nights?
Both. If I had to pick one, I prefer late nights, but I have to do early mornings. So, yeah.
Yeah. Save the world or shake the world?
Probably shake.
Yeah. You're a shaker too.
Yeah.
Anything you want our listeners to know before we close out the show today?
I'd love to stay connected. We're on Instagram. We're at Dr. Jade MD is like the hub of all of our social media. Our business page for the practice is Nspire Primary Care, no I in front of Inspire. Our website is inspireprimarycare.com. Again, no I in front of Inspire. So I would love to just stay connected and join following the journey on the Dr. Jade page. I really just share the behind the scenes of balancing all the things we just talked about. And if you're looking for really quality healthcare in the Las Vegas Valley, Team Inspire would love to care for you.
I know you would.
Yeah.
And I love that about you.
Yeah.
Thanks for being here today, Dr. Jade.
Thank you. Thank you for having me.
Yeah. All right, you heard me at the front end of the show. If you want to be in Vegas with us, we both live here in Vegas. Come join us at Lake Las Vegas, October 9th for TTL. And if not, stay in touch. Let us know how we can support you. Let us know what you learned in today's podcast episode, and we'll see you next time on Real Money. Thanks, Dr. Jade.
Thank you.
I hope you got a lot out of today's episode. And if you want more of this, make sure you check out my recent interview with Halcyon Health. They are making a difference from concierge medicine for women's hormones. And you've got to check out what Dr. Rachel has to say about how you can take care of your health, how you can make it affordable, how you can make sure your hormones are on track and become a member of this disruptive movement in medicine. Check it out right here, and I'll see you next time on Real Money.